Every dentist I've ever talked to in my entire life, every single one, swears that he has a good referral program. In fact, some dentists think they don't even need to market because they have such a good, strong internal referral program. But just getting a lot of referrals does not mean you have a good referral program. I'll tell you why when we return. Colin Receveur here, and welcome to another Saturday edition of the Patient Attraction Podcast. Now, if you're a dentist who doesn't have a good referral program, you have a serious problem. If you're not getting 50% of your new patients from referrals, that's a sign that there's something going on in your practice. Referrals are a form of internal marketing that some dentists think is so important, it's all they focus on. But even if you have lots of referrals, you're still not maximizing this most important form of internal marketing. Because if you think that doing good work alone will get you referrals, it won't. Even if you encourage patients to endorse you, they might not. Now, think about it. Do you really think that patients are going to say, man, I was so afraid of the dentist that I let my mouth go to hell, but my dentist told me about sedation dentistry and now I don't cry at the thought of going? Or someone might say, man, after years of smoking and neglect, I was lucky to only be missing a few teeth. My dentist gave me some great implants. Don't they look awesome? Now, no one wants to highlight his or her flaws. So why should they draw attention to themselves on the dentist's behalf? You're never going to convince a woman to say the word denture, and there's about a 75% chance they're never going to admit that they have implants. Men, a lot more likely to admit to that. So you're left with patients who have benefited from some of your best work, but are reluctant to talk about it. Now, of course, you can make referrals a stipulation of getting the procedure, and some dentists do. But the flip side is that you might be getting a high quantity, but low quality. Are you really going to finance your retirement or your kids' education with a lot of drill and fill referrals? Or referrals from patients they're only interested in what their insurance covers? Probably not. You got to know the right ways to ask the right patients for the right referrals. Now, that's a different discussion and perhaps subject of a future podcast. But what I can say right now is that you've got to have a great rewards program that offers real rewards in exchange for quality referrals. You got to make sure the filter's on. Even in places where rewards programs are prohibited, there are perfectly legal ways to encourage patients to refer quality patients to you. The mistake is in not taking advantage of the systems that will automatically get patients to deliver quality referrals to you. I want to talk about this a little bit more tomorrow. Until then, keep moving forward.